My name's Adrian Richards, and in this video I'm going to be talking about some of the different techniques which are available for labia minora reduction. So just to recap, the labia minora are the inner vaginal lips, and in most cases they really shouldn't hang down. So if you look at yourself from the front, they should really lie inside the labia majora, so they shouldn't hang down below the level of the labia majora, which are those external swellings on either side of the labia minora. So if the labia minoras are a little bit too long, the old technique, which was used quite widely, was just really to trim them and remove them almost completely. Now, this did work, and certainly they were reduced by this treatment. However, we've now evolved slightly, and we've got more advanced techniques which don't just completely remove the labia minora, but actually leave them smaller and neater so that they exist, because they do actually perform a function of lubrication in the area. So by completely amputating them, you can decrease the lubrication in the area and cause problems with intercourse and comfort. So really, techniques have advanced a lot, and depending on the area of excess, your surgeon will discuss the best way forward for you. So overall, the techniques now aim at maintaining your labia minora, but reducing them in height and width and length. So what we need to do is really look on either side to assess, are the labia minora even? Are they equal on both sides? Are they bigger towards the front or towards the back? And really they're very variable, but depending on the appearance of your labia, your surgeon will recommend a procedure for you. Probably the most widely used procedure is so-called a wedge excision, which removes a triangle of labia from the back, but does maintain the top of your labia. So when the triangle's removed, it's almost like removing a wedge, the top of the labia, your natural labia, is placed down, and then you have stitches on either side of this. So you will have, in essence, much smaller labia, which look normal because the top of them is normal. On either side at the base, in the natural skin crease, you will have a scar which is very well concealed because it's hidden in the natural skin crease. So a wedge excision is probably the most commonly used, most modern technique for labia reduction. The stitches used are all absorbable, and the advantages are that the area is going to look completely normal. No one will really know that there's any surgery's been performed. The incisions are going to be nicely concealed in the natural skin creases, and you're going to maintain your normal labia, albeit smaller, neater, and certainly they won't protrude over the labia majora. So modern techniques will produce a very natural appearance. Functionally, any chafing or any discomfort you get in the area will be absolutely fine, and intercourse should be fine after a recovery period with no problems in that area. So if you are considering this type of surgery, obviously it's a very sensitive type of surgery to consider. I think probably the sensible thing to do is to have a good think about it, research the topic online, and if you would like to email us, please do so, and we'll be able to give you an opinion as to the best type of treatment for you and answer any of your queries. And if you would like to, please come along for a consultation with one of our surgeons. We're very sympathetic, and obviously everything will be treated in strictest confidentiality, and we'll be able to tell you in person whether this type of surgery may be appropriate in your case.